Today we're kicking off our statewide Louisiana Healthcare Education Coalition. The coalition's purpose is to push out as much information as possible about all the changes that we will see occurring in 2013 as a result of the Affordable Care Act.
What kind of changes will the average person see in any area as a result of the health care reform?
The major change we're experiencing today is the way that most people will be purchasing their insurance. For the first time, we are delinking the employer with the responsibility of purchasing insurance. Most people will be purchasing insurance on an individual basis through what they call the exchange, or now it's being referred to as a marketplace. These will be individual products rather than group products, and these products will have attached to it an opportunity for individuals to be able to pick up a voucher or premium assistance from the government depending upon their ability to pay. We are here today to kick off exactly what the name implies, the Louisiana Healthcare Education Coalition. There's a lot of change descending upon Americans, and certainly this is an opportunity, we feel, as a coalition to push as much information as we can out into the marketplace. Any time that you re-engineer 18% of the economy all in 1 year, that's going to create a huge challenge for us to inform Americans as to what that change really means. Fact of the matter is, according to research conducted by Kaiser, 57% of Americans still don't understand what the Affordable Care Act is and what changes we should expect. And I'd like to see who those other 43% are, because they're continuing to promulgate rules as I sit here today before you. And so many of us are still working under the assumption that what we see is a path is not necessarily a clear path. So the purpose of the coalition is to inform and it's to educate as many people as we can about the changes that they will be experiencing. The biggest change I will point to is effective 10/1. America will be subject to being able to purchase their insurance on what's called a marketplace. It was referred to earlier as an exchange, but this is an electronic website, so to speak, where individuals will be afforded the opportunity to purchase multiple types of insurance plans with an opportunity, depending upon your income levels, to access premium assistance by the government. It's estimated that roughly 75% of Americans will be eligible for premium assistance in order to purchase their insurance. But you have to go to this exchange in order to purchase that insurance. So we need to do as good a job as we can informing all stakeholder groups, from producers to employers to individuals, on what choices they have in order to exercise these opportunities that are afforded them in the exchange environment. So today we are here to kick off the Louisiana Healthcare Education Coalition, whose purpose it is to push information out into the marketplace to help Louisianians specifically understand what some of their options are. I'd like to thank everyone for being here. I'd like to certainly thank all of our coalition partners. And the first coalition partner that I'd like to introduce today that's with us is Stan Harris from the Louisiana Restaurant Association. Stan, if you would. And we'll be back up at the end of this for a brief Q&A session.
Thanks, Mike. It's a privilege for me to be here today. The Louisiana Restaurant Association has members across the state. Our industry is the largest private employer in the state, and will generate about $6.8 billion in revenue in Louisiana alone in 2013. The number one inquiry that we receive today from our members is what's happening in the healthcare landscape. It's changing. They would like us to give them very simple answers to what we see are very complex issues and questions. And as Mike made a point, and the rules are being developed each day. So the answer that we give you right now may not be the answer that we give you 3 months from now. We're hopeful that by bringing our association into the Healthcare Education Coalition, that we can work together to provide this type of information, and that we can educate our members and give them more of what they need, because the first first way we start a meeting is what keeps you awake at night. And when we do talk to our members, this is the #1 issue. They can figure out from a numerical thing what happens with taxes. They can figure out when they look at where their challenges and where their competition comes from. But this is an area now that's kind of a dark area for them, and they're looking to us for enlightenment. They're looking for us to help them, and they're looking for us to help make it better for them. You know, a lot of our members are in the 50 to 100 employee area, about a third of those. And that's an area that's always been kind of in the gray, and they're coming now into that. We have some small employers, but another third of our business are large employers. So, you know, this is an opportunity for us to educate them, for us to inform them, and for us to bring a lot of people into a system that they may not have participated in before. So we see it as a great opportunity to lead and to be part of what's happening with LHEC. LHEC is something that we're glad to have the opportunity to do. So thank you.
The Louisiana Public Health Institute is proud to serve as a coalition member and assist with the dissemination of healthcare and wellness information to the populations we serve, which tend to be the most vulnerable segments of our society who lack access to affordable, quality, and patient-centered care. LPHI is a statewide nonprofit organization that serves to improve population-level health outcomes. Our mission is to improve the health and quality of care of all Louisianians, regardless of where they live, work, play, or socialize. With an estimated 938,000 people in Louisiana without health insurance, our challenge is to reach as many of these people as possible, many of whom are traditionally hard to reach, and help them navigate through the healthcare system. LPHI fully supports the Louisiana Healthcare Education Coalition's commitment to educate consumers on the major drivers of healthcare costs, the critical importance of personal wellness, and the need for access to quality healthcare. At LPHI, we have a positive track record of working with the community at large to achieve big goals. We recently launched the city's first health information exchange and established a 21st century care management system that is transforming how care is being delivered throughout the greater New Orleans area. As Associate Director of Health Systems responsible for community engagement, I appreciate the diversity of coalition members and look forward to working with everyone to expand access to quality health care for all Louisianians. Thank you.
Good morning. I'm Dr. Tony Greco. I'm the lead medical director at Blue Cross of Louisiana. Thank you for coming. The Patient Protection Affordable Care Act is responsible for the most sweeping changes we've seen in health care in the past 50 years. And it will help make health coverage available for more of the thousands of Louisianians who do not have health care coverage. Every Louisianian should have access to quality health coverage, and Blue Cross and Blue Shield has been here providing service to Louisiana since 1934, and it's our goal that every Louisiana citizen have health care coverage. Coverage is not only critical for the overall physical, social, and mental health and the prevention of disease and disability, but it's also for the detection and treatment of health conditions. It positively impacts the quality of life, that is, health care coverage. I can't emphasize enough how personal wellness and physical health go hand in hand. When individuals are armed with the tools to invest in their own health care, their own wellness, the outcomes are measurable and meaningful. Healthy people stay healthy. Health-related behavior changes reduce risks, and those with serious health concerns will be able to receive the right care when they have coverage. We know that this message, part of the bigger coverage is critical message, can have a broader reach with larger impact when we add more voices to the team. As a healthcare, community, business, trade, or faith-based organization, you play a critical role in supporting this initiative, and you help guide your membership through the many changes and challenges life has. At this important time, when we face monumental changes to healthcare in Louisiana, it will be no different. Your membership will want to know where to turn, help them understand the new landscape. There's a lot to be navigated. This health insurance marketplace that Mike mentioned is something we've never seen before, so it's going to take helping our members, our citizens, our patients to see all the changes and choices that are before them. So this is why we ask you today to join us in helping Louisianians navigate this new healthcare landscape by becoming a member of the Louisiana Healthcare Education Coalition, or LHEC. As a member, you get to decide how much or how big of a role you will play in the coalition. Opportunities will range from hosting educational events to just writing letters to the editor of your local newspaper. Or you can simply just take care of your own folks. Give them the message if that's what you decided your role is going to be. So thank you for your commitment. I know your time is valuable, and thank you for making this a priority today, because it's certainly our priority for better health care in Louisiana. Mike?
Thank you, Dr. Greco. At this point, I'm more than happy to field any questions that you might have about the coalition. Why don't I start with just an expanded explanation of what we will be experiencing in 2013. Effective 10/1 of this year, the exchanges will come up live. This is what's being planned by the government right now as we speak, for a 1/1/14 effective date. On those exchanges on 10/1, there will be multiple products listed on the exchange where individuals will have an opportunity to choose based upon the plan that best meets their needs, their benefit package that they want to purchase. They'll have an opportunity to apply for that plan online for a 1/1/14 effective date. Again, depending upon your ability to pay will determine how much you will pay personally and how much government assistance you'll receive as part of your premium assistance. So there will be significant premium assistance provided you purchase your insurance on this health information exchange. It's called a marketplace now. So with that in mind, there's significant change. I think we'll see a very noisy summer. There's money in the Affordable Care Act that provides the government an opportunity to do a lot of advertising. So you'll see a tremendous amount of information being pushed out in the marketplace this summer. I think you'll see, in addition to people in coalitions and associations and drugstores who are trying to help their customers understand and navigate all these changes, you'll see the competitive industry, ourselves and others who are introducing products on the exchange out this summer trying to encourage people to purchase their products on the exchange. So I really believe that we're in for probably an unprecedented amount of information overload in a very short period of time, trying to prepare everyone for a 10/1 date. And that's why it's so critically important that we have the Education Coalition out making unbiased information available to various stakeholder groups and the members that you serve, to give them as a trusted advisor a place for you to go to receive information. So that's it. It's a huge task. We have an opportunity, as I see it, to take advantage of a lot of reform that's going to occur over a short period of time, build a better system, a better way for Americans to access health care, and bring some stability to the premiums and the cost of health care in America today.
What type of information are people going to need to make the right choice for them when it comes to their own health insurance?
Well, that's where it gets really confusing. There will be multiple products being offered on the exchange, and it'll be left up to the individual to determine the product that's most appropriate for them. So these will be electronic marketplaces, so to speak, where individuals will go out and shop for different types of insurance and insurance plans that best meet their needs, and the enrollment process will all be done online.
How did the coalition come together?
Well, the coalition came together as a result of an understanding of a need for us to be able to better educate and inform the marketplace about all the changes that will be occurring in 2013. We are re-engineering 18% of the GDP. As a result of that re-engineering, there will be a lot of changes, and unfortunately, so many people at this point are unaware of all the complexities associated with the changes in healthcare. It's been estimated through Kaiser that roughly 57% of Americans have no idea about the changes that they're going to be experiencing. These changes go into effect on 10/1 of this year. So the purpose of the coalition is to push out as much information and inform the general public about how to shop for their insurance and how to go about securing the right insurance plan that meets their needs.
As a doctor, the greatest value that the coalition will offer to members and patients is the fact that we will help navigate these people through all the changes in the healthcare system, of which there are many now, and when they learn to navigate the new landscape of the healthcare system, it will help them with their own wellness and help them select the products they need to be more engaged in their own health care.
LPHI is a proud member of the coalition, which focuses on the dissemination of healthcare information and information that will help individuals that currently do not have health insurance help navigate them through the healthcare process. And LPHI has a lot of relationships with this particular segment of the population, which tends to be the most vulnerable and lacks health insurance and basic health coverage. And so we're very proud to leverage our resources to help the dissemination of the message to those individuals.
How do we get the amount of information out to our membership? We've got a very robust membership across many levels of the economic strata, from small employers, mid-sized employers to large employers. And the one question we ask more than anything is what keeps you awake at night. And healthcare and going through the new healthcare landscape is something that comes up at the head of the list every day.
What's your reaction to what you've heard and seen here today?
All of this is very positive. The sooner we start, the better. The more information that we can get out to people in an unbiased manner, obviously you're going to have a large supplier network that's going to want to have products in these exchanges and in this marketplace. But what we've got to be able to do is show people where to get that information, who's affected by the information, what type of government assistance may or may not be available for their specific situation, and move this to say that we're trying to expand people who are covered in the healthcare system under the Affordable Care Act than were in the system that we had before, which didn't include everyone.
The good thing about the coalition developing, and especially on a statewide basis, is that we'll be able to reach pretty much all the citizens in the state of Louisiana so that we can help them engage in the changes that are about to occur in our healthcare system.
Are you encouraged by the potential that the coalition has to offer?
Absolutely. I mean, we have approximately 30 partners now statewide, and so we can really help the Louisianians navigate this landscape.
Okay. For people that have health insurance now through their employer, is there guaranteed they're going to have that insurance after October?
That's another stakeholder group, employers, who will have to make a decision whether or not they will maintain their group health plan for their employees, or they will abandon their health plan and encourage their employees to go to the exchange and buy insurance on an individual basis. So that's another individual decision that small employers primarily will have to make as 10/1 of this year approaches. Most of the larger employers, over 100 lives, we expect to maintain their group health insurance coverage. We fully expect employers with 50 employees or fewer to have to be confronted with that decision about, do I maintain my group plan or do I eliminate my group plan and have my employees purchase individually on these marketplaces or exchanges.
For people that have no insurance currently now, this will be a new experience for them to purchase insurance. What are the steps that they're going to need to follow?
They'll go through the same process that people with insurance today go through. They'll go to these exchanges, and they will pick the plan that most appropriately meets their particular needs. Under the Affordable Care Act, there is an expansion of Medicaid that's available that in the state of Louisiana, we've elected at this point in time not to expand. So consequently, there will be a group of people, an additional group of people, who will have the opportunity to go to the exchange and purchase insurance through the exchange on an individual basis.
What's your reaction to how the coalition has come together?
I think it's been terrific. I think that as Louisianians, we understand the need for us to try to push out as much education and inform the general public here in Louisiana what types of changes they should expect throughout the course of the year up until 10/1.
This is a very, very exciting opportunity for us to be able to go statewide and partner with large trade associations, medical providers, clinics, insurance providers, and the producer community so that we can sit here together and say, these are the best opportunities for Louisiana and Louisiana citizens to consider what's available in those marketplaces and how they can discern what are the differences between the different levels of product and the costs.
If people have questions or like more information about the coalition and its work, what should they do?
Well, there's a website they've developed that will help people answer these questions, and the website can be found at lhec.net.